welcome. My name is Calliope, and for this examination, you are more than welcome to close your eyes. I'm not going to need your eyes open for any of these tests, and the entire time, I'm going to be explaining exactly what I'm going to be doing so that there's nothing that startles you. Okay, so I would love to start by just looking at your ears, if you don't mind. Okay, you can close your eyes if you wish. I'm going to start by grabbing my otoscope here and attaching a speculum, and then we'll look at your ears. So, I just want to check that they are symmetrical and they're of the right size for your proportions, that they're not swollen or overly red. And now I'd like to palpate around them, if you don't mind. Okay, so we're gonna go behind them and just feel the mastoid process here. And then in front, for your auricular area. Okay. Out to the back. Good. Is any of this painful at all? Okay, do let me know if it is. Okay. I'm just going to take a quick look here. So, I'm just going to pull the ear forward because you can't see behind your ears, but I can. Good. The other side, looking for lesions or skin abnormalities here. Okay. Now I'm going to be palpating the ears themselves using my first 3 fingers primarily. I might be stretching them, might be pressing down on them, pinching them. Let me know if this is uncomfortable. Okay, pulling down. Good. Okay. Pinching around. Pulling up. Pulling down. Good, and I'm just going to press the ears against the head. Good, and just pull them forward. Okay, no pain. Alright, let me just gel down. So, the ears are non-hard, they are flexible, they are non-swollen and tender, symmetrical bilaterally, present. And the color is normal. So now we're going to bring in the otoscope. I am going to turn on the light, and I'm going to pull the ear up so that we can straighten out the ear canal, up and back. And I'm going to put the otoscope in your ear. I won't be pushing it any deeper than I need to, just pressing it inside. And then if I need to change my view, I'm the one who has to rotate and get closer. So let me know if any of this is painful or tender at all. Okay, here we go. So we have a clear ear canal. No color changes. We have an intact tympanic membrane with the translucent pearly gray sheen. We have the tip of the malleus easily visible. Everything there looks just fine. Okay, and the other side here. So pull up and back, and then put the otoscope into the ear. Okay, so the ear canal here, unobstructed, no irritation, skin abnormalities, no swelling. We have the correct color and pearly gray tympanic membrane, no perforation, flat, no bulging or retraction. The tip of the hammer there, cone of light present bilaterally. Good. Okay. Turn that off. And then I have a couple of tuning forks here. And we're going to do something very simple for a hearing test. I am going to have you tell me whether the sound is higher or lower pitched. So that is higher pitched. That's our 512 hertz fork. This is our lower pitch. This is our 256 hertz fork. I'd just like you to tell me whether you hear the higher pitch or lower. Lower. Higher. Lower. lower, higher, higher, lower, higher, lower, lower, higher. Very good. Let me put these back. There we are. Now, let me just grab my stethoscope here. I'm going to pop in the little earpieces, and we're going to take a listen to your heart and lungs. So, the flat part, the larger circle of the stethoscope is called the diaphragm. The smaller domed circle is the bell. We are going to use the diaphragm on the lungs, the bell on the heart. So let's start with the heart. So I'm going to be just to the right of your sternum to start. You can just breathe normally here. And this first valve is the aortic valve. And we're going to go right over to the other side to listen to the pulmonary valve. We're going to go down 2 intercostal spaces to listen to the tricuspid valve. Good. And then along the mid-clavicular line and down a little bit more for our mitral valve. This one's a bit out of the way compared to the others. Now the apex beat here is going to be the mid-clavicular line, and let's just count the intercostal spaces. Okay, should be right here. The bell of the stethoscope is used to hear lower pitch sounds. The diaphragm is for more higher pitch sounds. You can use the diaphragm for most everything, but the bell helps you get a little more specialized. So, we're going to start at the lung apices, which are above the clavicle, right up here. And I'm going to have you take a deep breath and exhale. Good. And we're going to move from one side to the other so we can compare the two. Inhale and exhale. Okay, we're going to move down a bit and continue in this ladder-like pattern till we get to the bottom of the rib cage. Deep breath in and out. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. One more. Inhale. Exhale. Good. Now, if I could have you turn around for a moment, then we can listen to the posterior chest wall. Good. Starting back up at the top. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. And exhale. Good. And if you could just flip back around for me. Good. Now I'm going to listen to your abdomen here. You can breathe normally. You'll feel the diaphragm of the stethoscope on each quadrant of the abdomen. Listen for just a few seconds before moving on. Okay, and this side. Good. Last one here. Okay. We are going to just put this back around my neck here. we have some notes here. Good. Intact bilaterally. We get to our heart and lungs. Auscultation. Okay. Once we finish our abdominal exam, we can finish those notes. So I'm going to be placing one hand over the abdomen here, and with my other hand I'm going to be tapping on my middle finger here, and that gets this tapping sound. Use this sound to determine if an area is solid, if it's dense, if it's hollow, if there's fluid, if there's air. So I'm just going to run my hand over the abdomen, tapping along to see what's going on inside. There we go. We can find organs here. We can see what's going on in the intestines. You'll hear the sound change as we go along, so we can tell where the liver is, because it's very dense. We can tell where the stomach is. It has a bit of a different sound. And the intestines here, like that. So now I'm going to be palpating the abdomen. I want you to tell me if there's any pain or discomfort. Okay? So I'm going to start by the stomach here in the upper left quadrant. And work my way clockwise. The intestines, make sure the organs are the right size. Make sure there's not any tenderness or rigidity, guarding. Okay. Any pain? Okay, so now we can jump back into our notes. So, upon auscultation, on palpation. No pain, tenderness, guarding, rigidity. Okay. Now, let's turn our attention to your face. I have a few tools here that I'd like to employ to test your facial sensation. I'm going to start with a clean wooden specimen stick, and I'm just going to touch your face in different areas, and I'd like you to just tell me when you feel the touch. So keeping your eyes closed, tell me when you feel the touch. Good. Yep. Good. Yes. Good. Yep. Yes. Very good. Now, another test here. We are going to use a very soft brush. I'm just going to test it on the side of your face here. A soft brush or a pointed tip. I am using a set of calipers. I'm going to be doing this on the side of the caliper so that it doesn't hurt at all, but you do feel that pinprick of contact. This is what that feels like. Okay? So just tell me whether you feel the soft touch or the sharp. Keep your eyes closed. Soft. Soft. Sharp. Soft. Sharp. Sharp. Soft. Sharp. 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 Soft. 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 Sharp. these down, we have something a little different. Still a sensation test, but I'm going to unfurl the calipers until they have about 2 inches between them. And I'm going to have you tell me whether you feel 1 touch or 2, right? Okay. 1, 2. 2, 2. 1, 2, 1, 2, 1, 1, 1, 2, 2, 2, 1, 2, 2, 2, 1, 1, 1, 2. I am going to tighten the calipers, put those together, and we're going to do a little bit more examination on the face. These calipers rather secure, so it takes a moment to just get them all the way tightened. There we are. Let's look at your face. So I'm going to get in real close and examine it visually to start. And then we'll do some palpation around the face and the perimeter. Good. Just looking at color, just looking for any skin abnormalities, any areas of concern that I need to keep my eye on and investigate further. Okay, I'm going to use one hand to just assess the texture of the skin. So we'll start up here at the forehead. And then work our way to the right cheek. The right cheek here. The right jaw. The chin. Left side of the jaw. side of the cheek. Left temple, back up to the forehead. Down the nose, back up the nose, along the cheeks, right cheek, along the mouth, above and below. Okay, so texturally, everything looks great. So now I'm going to do some pressure in some specific areas. You have 3 main sinus areas that I'd like to test. We'll start with some pressure and then some direct percussion. The frontal sinus is along the forehead here. Any pain or discomfort as I'm pressing here? Okay. The ethmoid sinuses are along the nose, the sides of the nose, and the maxillary sinuses are beside the nose, along the cheek here. Okay, and no pain with that. Okay, so this is where we're going to go a little deeper. I'm going to tap on each of these areas. And if there's any inflammation in the sinuses, that's going to show up a lot more obviously than the pressure. So let me know if there's any pain. Good. And nothing there. So let's jot the notes down. Facial sensation of cranial nerve 5 trigeminal intact. Touch response. Soft, sharp, differentiating. 1 or 2 touch discrimination. Okay. Inspection upon palpation. Okay, and sinus palpation and percussion. Good. One last test here. I'm going to get my Deggerin hammer here. The Deggerin hammer is not a very commonly used reflex hammer, but it is pretty beefy. We are going to use this hammer to test your reflexes. We're going to start on the feet. So I'm going to have you put your foot up here on my knee. There we are. I'm going to hold your foot, and we're just going to put a little bit of tension on the Achilles tendon here. And then I'm going to tap the back of the tendon to get that reflex. Good. And the other foot here. Okay, I'm going to maneuver you and hold the foot. And we can get this reflex. Okay, now you're going to put your legs down and just let them hang freely. Don't put any effort into letting them just swing. Just let them relax. We'll do the patellar reflex here. Great. The other side. Just let the legs swing freely. Oh, that one. There we are. Okay, so for the arm, let me see your arm. I'm going to position this so it is lying across your thigh here. I'm going to need the back of your elbow and the front. So let your hand just dangle in the space between your legs. Okay? Yep, that's all floppy. And I'm going to tap on the back of your elbow to start. That's the triceps reflex. And I'm going to turn your arm out. And I'm going to hold the crease of your elbow here. And put my thumb right in the middle. And I'm going to tap on my thumb here. Okay, and that's the biceps reflex. So you take that arm back, and I need this arm. Okay. Same thing, let it go floppy. There we go. Back of the arm to start. Okay. Turn her out. And put my finger in the crease of your elbow. There, get it positioned right, and you can take that arm back. Okay. Just note that down. The Achilles, the patellar, the triceps and biceps reflexes. Okay. Do you have any questions for me at all? Alright, well, that is going to conclude our examination. I see nothing out of the ordinary whatsoever. So if you don't have any questions, I'm going to sign off here. Okay? There we are. And that'll be that. I'd like to thank you so much for trusting me to perform this exam with your eyes closed. I hope you have a whale of a day and a good rest of your night. Thank you.